Hi, my name is Joan Tendler. I've compiled a great deal of information about what makes certain people very vulnerable to COVID-19. Now, there is so much data, so many studies that have been done that are not really being talked about. So that's why I put together a pretty complicated PowerPoint with, I think, a lot of pretty unfamiliar information. Um, so I will just decided to just read it as we go along. So, and I have many references, and if you're interested in seeing them, I would be happy to send a whole copy of all the references to anyone. You'll just contact me at the website that I talk about at the end, or you could also comment below. So just to get started, you can see the main thing that we're really going to be talking about is high blood sugar. And, and I would just be going over how modern oils, refined carbohydrates, and chemicals have caused what you would call a volatile terrain of high blood sugar, fatty liver, and inflammation. Also, how to change it with a low-carb diet. We'll just talk a little bit at the end about that. Now, for the critical facts that I'm going over, now the main predictors for COVID-19 death are high blood sugar, fatty liver, and low leukocytes. Now, those are virus-destroying cells. The main causes of severe symptoms and death are acute respiratory distress syndrome, or ARDS, and organ failure. The direct cause of ARDS is leukotoxin, which is produced in the body from linoleic acid, the omega-6 fat in modern oils. If large quantities of something called acrolein are present, leukotoxin destroys our leukocytes. The immune system, basically our immune system, our virus-fighting immune system. Now, COVID-19 is unique due to its arginine-rich spike proteins. I'm just going to go over to the side here. There's a diagram of it. This is a very well-known fact, but not much is made of it. Like, what does this really, why is this so important besides being more transmissible? So arginine is shown in R, and there are many more of them than in the other viruses. And the spike must be cleaved or cut, added arginine in order to enter the cell. And the thing about it, and we'll be talking a lot about arginine. Arginine is the source for inflammatory nitric oxide and the highly toxic acrolein. So acrolein, how do we get acrolein? Well, it's actually pretty common. For one thing, in the body, it's made from arginine. And also from linolenic acid, which is the omega-3 fat in soybean oil, canola oil, hemp seed oil, and flax oil. In the case that there would be high blood sugar. High blood sugar comes in a lot here. Acrolein is also made from linoleic acid in the modern oils when those oils are heated. Or it's also made with smoking. It's in the smoke. Also, high blood sugar does another thing. It increases infection by camouflaging the virus from the immune system. Now, 50%, this is an estimated 50% of Americans have high blood sugar, and this would be from insulin resistance. The sugar can't be brought into the cells, and diabetes. And this occurs together with fatty liver. Fatty liver. Now, what is that caused by? A combination of estrogenic chemicals, linoleic acid, alcohol, and refined carbs. I'm going to go over all of these things in a bit of detail. And then we've got high blood sugar, fatty liver is improved by a low-carb diet, not too surprisingly. So, these numbers really change, but of all the people infected with COVID-19, 40% or more, I've even read up to 80%, have no symptoms at all. And then another one said 42% had mild symptoms. So we leave about 18% or so having the severe symptoms. So, this is a small group compared to people who just don't even have any symptoms. Well, it's pretty obvious that in order to avoid further suffering and death, we need to ask that critical question, why has this virus been so tragic for a small group of people? Well, the vast majority of people have little problem with it. So this is really an important thing to look at the terrain theory of disease here. And this is that viruses, bacteria, fungi, and parasites are harmful mainly in response to their surroundings. And what are their surroundings? Let's see. A lot of this is going to be having to do with diet. Of course, the junk food, the top here. But, we've got these modern oils, and carbohydrates are really just everywhere in the diet. It's almost impossible to escape them without really making an effort. But then there's the estrogenic chemicals, and these are chemicals that are right in our house. We use them all the time. You can see lining of the cans, plastics, fragrances, detergents, shampoos, personal care products, soaps, pesticides. It's just everywhere. And this is another thing. It has to be a very major effort to avoid them. So the typical terrain of the highest risk groups, what do you find? So the highest risk groups are hypertension, obesity, diabetes, heart disease, asthma, COPD, sleep apnea, smoking. So the common factors that are true for pretty much all of them are fatty liver. When we get insulin resistance, high blood sugar, and that all goes together, the toxins we just talked about, and cigarette smoke contains acrolein, and this is all about the rest of these, the hypertension, the lung injury, also lung edema. It's acrolein is quite terribly toxic. Now, pathogenic bacteria also in these people. Now, those are in the gut, and that shows the leaky gut and this sort of thing. And endotoxins are the poisons that these bacteria make, cause a lot of problems. And then, of course, there's medications, blood pressure medications, and corticosteroids. And we have chronic inflammation, and this is definitely true especially with the elderly, and this decreases our ability to fight COVID-19. So a new word, very important word, glycosylation, sugar coating. This is what happens when you have high blood sugar. It doesn't just stay in the blood, it gets on things. People in the high risk groups for the severe symptoms and ARDS often have insulin resistance, fatty liver, and high blood sugar. So the best explanation, the best predictors of COVID-19 infection are high liver enzymes, which shows the severity of fatty liver, extent to which the hemoglobin is coated with sugar or glycosylated. So that's the measurement of high blood sugar. And then the low numbers of virus-killing leukocytes. Now these also are activated by zinc. It could be important right there. Now, just focusing on fatty liver, it actually doubles the risk for ARDS and severe symptoms. So this is, and you just taking a look pretty clearly, you don't want a fatty liver. Is a very dysfunctional liver and causes many more problems. This is something to be really working on to improve. Now, what is so important? Why is this such a problem? Well, for one thing, COVID-19 itself is heavily coated with sugar. It's called extensively glycosylated. Now, all pathogens actually have sugar on them. It's taken right from our bloodstream. Everybody has some sugar in their bloodstream. But we're talking about excessive blood sugar. It actually camouflages the virus or the bacteria, the fungi, or the parasite from the immune system. Stabilizes and strengthens the pathogen. Now we want to be strong, right? But here we are strengthening the pathogen, which would be, I guess, pretty flimsy. But now it's able to do what it needs to do, is to enter the cell if it has the sugar on it. So, and here, this is one on the right, is Epstein-Barr virus, and really it's just all of them. All the bad ones are heavily, or at least they're with sugar. Now, even the ACE receptor needs to be extensively glycosylated, and then you'll get the serious infection. And in the elderly, even the natural killer cells, which are major virus destroyers, are glycated similarly, and that makes them, they're unable to fight the virus very well with them. Well, hemoglobin. This is our red blood cells where we get our oxygen. That's also glycosylated in people with high blood sugar. That's actually the measurement of high blood sugars, how much of your hemoglobin is covered with sugar. And then this also increases with COVID-19, that you might have been hearing about the hypercoagulability, which is the very tiny blood clots that are formed in the capillaries. And this is really a huge part of the problem. And in fact, we talk a lot about low oxygen, hypoxia. Well, that's why patients are now just given hemoglobin, because this is not functional anymore. Once it's glycated, it's not carrying oxygen. So people are low in oxygen for sure. So where do we get this high blood sugar? Well, essentially from the excess carbohydrates and the omega-6 fat and chemicals. It's really all about fatty liver here. We're just going to kind of talk about it interchangeably, because they feed each other, and it seems to be different opinions about which comes first, but certainly they're all together pretty quickly. So you've got excess carbohydrates are made into the saturated fat. This is the one dangerous saturated fat that they're always talking about when they say avoid saturated fats. It's palmitic acid. But probably the most important thing here to know is that most of the palmitic acid in our body is actually made from the excess carbohydrates, because it's being made so it can store as energy for later when you eat too many carbohydrates. And palmitic acid is the major fat found in body fat and fatty liver. Now, liquor, especially binge drinking, causes insulin resistance and alcoholic fatty liver. And basically, liver blocks ketosis. I'm going to talk a lot about ketosis, because this is really a basic problem here, because we can no longer burn the fat for energy, because linoleic acid, well, we'll talk about that, but liquor blocks it, first of all. And so if you can't burn the fat for energy, it needs to be stored. And then it ends up being stored in the liver. The second thing is omega-6 fat, linoleic acid in the modern oils is readily oxidized into harmful free radicals by chemicals, radiation, endotoxins from that bad gut bacteria, and just physical and mental stress. And these free radical fats block fat burning. They cannot be burned for fat. They're fats, but they can't be burned. So what are they? They're stored instead. And this is the modern oils that we've been told to eat for decades. So these fats circulate as triglycerides and are stored as body fat, but then they're stored in the liver. And this causes insulin resistance. So the sugar can't get into the cell, because the insulin is needed to take sugar into the cell, so we end up with high blood sugar. Excess insulin also causes fat storage and fatty liver, and corticosteroids that people take will do the same thing. Now, here's a great illustration of French fries as being a huge problem. And since 1990, extremely important, this is a big change from using beef tallow to fry French fries and just really many other things to the modern oils. And this was the big change from 1990 on. And then it was adopted by everybody, all the processed foods, and now they're absolutely in everything. And beef tallow isn't very little. So, problems. Linoleic acid seems to interfere with the insulin signaling. And this is what I was saying, it decreases adiponectin. And adiponectin is what you need for ketosis or fat burning. So this is blocked, and they can't, so this fat will not be burned for energy. And it's all tied in with the alcohol-induced fatty liver too. It's not just alcohol, because they did do this in rats. They induced an fatty liver with alcohol, but the corn oil diet part promoted it. It just made it worse. So it's this combination of non-alcoholic fatty liver and alcoholic fatty liver. And it's really what generally exists, is often a combination of the two. Now, and then of course the linoleic acid is easily oxidized, or it's actually harmed or turned into harmful sort of free radicals or other substances, like I said, the acrolein. And it's also in these HODs are actually a diagnostic marker for prediabetes, insulin resistance. So they are truly something to avoid. High insulin prevents fat burning. But when the insulin is low, dietary saturated fats will induce ketosis or fat burning. And so they actually prevent the fat accumulation. Because you can see with increasing free fatty acid concentration, you get closer and closer to a fatty liver with increasing linoleic acid. But dietary saturated fat will prevent it. It brings it all into the opposite direction as linoleic acid, regarding gut permeability, intestinal inflammation, the gut bacteria, and the gut bacteria toxins that they release, which are the endotoxins, the inflammation in the liver, and finally liver injury. And here's a study that just took soybean oil and compared it with coconut oil and fructose. Fructose is always talked about how terrible it is. And I think I just want to make it very clear that fructose, the reason it's called high fructose corn syrup is that corn syrup doesn't have any fructose in it, and they managed to get fructose in it. Well, it's virtually exactly the same as sugar. It's about half and half, slightly more. So you really, to kind of blame everything on high fructose corn syrup and thinking that sugar is perhaps better is just not true. And here, even fructose, which is a problem for fatty liver, the fructose part of sugar for sure is, because it goes right into the liver and it can't be used for energy. So they did get, but even with the fructose, the soybean oil was worse for increasing obesity, fatty liver, insulin resistance, and then just what marker for diabetes, was worse with soybean oil than with coconut oil and fructose. And of course, this basically the level of this omega-6 fat actually usually has HODs, but in our body fat has just, obviously risen tremendously since 1960, as fat has risen tremendously, increased 200%. So what to do? There is a fat, an omega-6 fat, that is actually extremely important that linoleic acid is displacing, and that's called arachidonic acid. That is only in animal foods like eggs, meat, fish, and butter. And, um, and we need that to replace it. That's the normal thing in our cells. And Artemis Simopoulos says she's a doctor who's very interested in the omega fats. And it's really important to think about the omega fats because they're actually the only essential fats that we have. All the other fats the body can actually make in the body, but not the omega fats. We have to get them from dietary sources. So we have to be, and they're extremely important because they are converted into all these different hormones, many hormones that are absolutely critical for health. And here we have the more arachidonic acid and EPA and DHA, the less insulin resistance there is. But higher levels of linoleic acid are found with insulin resistance. And with regarding COVID-19, dietary arachidonic acid enhances the lymphocyte response that destroys the flu virus, while low levels of lymphocytes were associated, of course, with poor outcome in patients with COVID-19. Specifically, arachidonic acid does protect from fatty liver, viruses, and chemicals. For one, it's critical for many things, but I'll just go over these regarding these issues. For healthy liver, pancreas, heart, and gut, there's a lot of arachidonic acid that's supposed to be in these organs, and this is via these incredible hormones that are derived from arachidonic acid. EET, PGI2 is called prostacyclin, and PGE2 and lipoxin. Now, vegetarian animals, or mice and rats, which were close to being vegetarian, make adequate arachidonic acid from linoleic acid, and they, eat seeds and the kind of, soybeans and all that stuff as a regular diet. But humans cannot. We can't make enough. But this is especially true with obesity, diabetes, and old age, because insulin, which is high in these people, blocks the enzymes that are needed. So they will test low in arachidonic acid. And a nice study said that mice that could not make arachidonic acid, they all developed fatty liver. This is really critical. It's one or the other. So going one at a time, the EET, and we're going to talk about EET later because it's nothing short of amazing what EET will do, prevents insulin resistance, sodium retention, hypertension, organ failure, strokes, and far more. And then there's prostacyclin. Well, that specifically prevents the fibrosis and the cirrhosis. So those are all the lesions and the scar tissue in liver diseases and the pancreas. And here, prostacyclin, this is very important, protected the insulin-producing beta cells from a chemical that is used in laboratories to induce type 1 diabetes, because it destroys those beta cells, as chemicals do in type 1 diabetes. Well, arachidonic acid's prostacyclin protected it. Then PGE2 prevents a leaky gut, and this is the reason that aspirins cause ulcers, is because they block PGE2. And so essentially it prevents the growth of bad gut bacteria, which comes about from a leaky gut. And then there's lipoxin. Lipoxin initiates this major thing that isn't happening anymore for many people, the all-important switch from the inflammatory to the anti-inflammatory state or immune response. And low levels of, this is from a study, particularly arachidonic acid in muscles, are linked to hyperglycemia or high blood sugar. And with the high blood sugar, the levels in the platelets was significantly low. So just briefly, one thing that just explains partly why it is so incredibly important, it's the most ketogenic of all fats. It induces ketosis in the strongest way of any other fat. And it's only available in animal foods. Fewer people now are eating, and it's not really so much in it's not really in fat. It's in fatty meats, but not in the fat as much, because it's stored mainly in muscle. It's not a storage fat, and it's a supplement for muscle building. It's also stored in the heart, um, the liver, and various other places, organs, kidneys, and um, and the heart absolutely requires a lot of arachidonic acid for its functioning. So looking closely at this leukotoxin, this is because it's very important to look at what's happening with this leukotoxin, because that is the direct cause of acute respiratory distress syndrome. Also, this thing called disseminated intravascular coagulation, which is the making of all these little blood clots that you maybe have heard about. Um, so, so basically, this comes right from that linoleic acid. One of the many free radicals or harmful substances from it. If there's a large quantity of acrolein, and it has certain enzymes that do it, there's a very specific one. I found like 4 of them. And what's incredibly interesting is that we've got, if linoleic acid is there, it means that it has displaced the arachidonic acid that would normally be in that same position in the phospholipids that are on every cell. Well, it all depends what happens with the exact same enzymes. These enzymes will either cause ARDS, but if arachidonic acid is there, it will cause that, or convert arachidonic acid into this amazing thing called EET. And here we have the long list. It just prevents insulin resistance, resolves inflammation, protects the lungs, prevents fatty liver, all the way down, cardiac injury, reduces neuropathic pain. It basically, and how does this do? This is one of the ways that arachidonic acid is so important about how it induces fat burning. It, instead of storing it, which causes so many problems, it just burns it for energy, which is amazing and is incredibly important to do. So it's just night and day here. Interestingly, about quercetin, it inhibits these enzymes, these CYP enzymes that do this thing one way or the other. Well, quercetin inhibits that, and it is also found to reduce insulin resistance. So it's preventing this problem from happening, and also quercetin may be an adjunct therapy for COVID-19. So now we're going to just look at acrolein a little more carefully. Acrolein is very common, but it really needs to be avoided. It's made both in the body and outside of the body. It's arginine in the protein spikes in COVID-19, plus the high blood sugar forms the acrolein. Here's a nice diagram showing that. Interestingly, this enzyme that is kind of the major one here, ornithine decarboxylase, it's actually blocked by chloroquine, which is also about it's this major malaria treatment, and malaria uses this too. In fact, all parasites use this. They don't need acrolein. They need spermidine just to replicate. So this is a very key part of this whole thing. So they're going right for this ornithine decarboxylase, or if it's already being activated, they will replicate. Well, guess what activates this? It's not actually insulin. Basically, insulin and high blood sugar activate it. They activate ornithine decarboxylase, setting the stage for greater infection because of the spermidine is a DNA kind of thing that you need. Polyamines are what they make the DNA out of, so they can replicate. So insulin is a huge problem here. So there's a lot of arginines on the spikes at the site of cleavage. Now, um, now arginine, like I said, is made into this acrolein. It's also made outside of the body from the omega-3 plant omega-3 linolenic acid, and it's also found in charred meat, which makes that very dangerous. So now large amounts of acrolein convert that if they're present, it's a very inflammatory environment with that, and then you'll get the leukotoxin. And by the way, also malaria is a rare case, rarely, but it certainly happens with malaria that you end up with this ARDS as well. It also happens with smoking. So this is not a specific thing just to this COVID-19. It's a specific thing to acrolein. The now the enzyme that forms acrolein, this ornithine decarboxylase, interestingly, it has a lysine binding site. It's activated by something touching or binding to a lysine amino acid. And I researched estrogenic chemicals quite a bit and found every one I've ever found ends up binding to lysine because it is on the active site quite a bit, and it's just kind of maybe more vulnerable. But they might activate this enzyme. I didn't find anything particularly on that, but we might just have that as part of the problem. It's certainly involved with these people. So let's look at lysine. Lysine, just burning fat, kind of getting to the point of thinking about preventing, the vulnerability to COVID-19. So lysine is absolutely necessary for burning fat because it is converted into carnitine. And so what they found in a really nice study, lysine was essential to all of these things: control cholesterol, very low density cholesterol, the worst basically, and the triglyceride production, and which then causes fatty liver. And also it regarding cortisol, that's released in response to stress, and that causes the body to store fat. Again, it prevents burning fat, as well as hypertension. But lysine lowers the cortisol response to stress by lowering activity in the amygdala. And that, if you're not familiar with it, is the fear and emotion center in the brain. It is a very calming amino acid, and it is often low. Like I said, these chemicals will bind to lysine. Quite a few chemicals do that, and lysine is often low as a result, with obesity and also diabetes, hypertension, and heart disease. They're all tied in with this. So, and then it also has to do with preventing this inflammatory nitric oxide, which drives the virus replication. And it is, and this inflammatory nitric oxide is a major part of the cytokine storm that will cause death with COVID-19. Now, the source of inflammatory nitric oxide is, again, back to arginine. And of course, we have arginine-rich spikes. So lysine is really a key player here, and it will improve all those situations because it controls arginine. And in a study, lysine plus vitamin C and other ingredients was effective with influenza A, which is a pandemic-causing virus. Lysine also activates vitamin D. So if you have problems with vitamin D, similarly to how zinc and lysine are both necessary for vitamin D. So this is all kind of tied together. Just talking a little bit about the foods that are higher in lysine. It's all just basically traditional foods that people have eaten, but kind of the newer plant proteins being peanuts and soy and a lot of grains and a lot of nuts and seeds and chocolate. Those are higher in arginine than lysine. And you really have to make sure, since arginine is not an essential amino acid, the body makes all that it needs. There's some places saying that it needs more, and that maybe in some cases it does, but lysine is absolutely an essential amino acid because the body cannot make it. So we have to make sure that we have plenty of lysine and be careful with not getting too much arginine. So I just want to mention this whey protein because we are talking about prevention here. The best source of lysine is whey protein powder. And there's a couple of interesting things. It will actually reduce liver fat by 21%, just 2 servings a day for 4 weeks from a study. It also, if you get the low heat processed, it also contains lactoferrin, and this has prevented SARS-CoV, the first one, infection by preventing the host cell attachment. It's also the best source of glutathione, which is the one thing that you need to break down acrolein. So just to understand, there's some really important things to help us in this. Specifically, zinc deficiency is just very important to focus on. People with diabetes and obese people are low in zinc, and with these people then, if you're not low in it, it probably wouldn't help to take, zinc. But we tend to deplete it so much. This is definitely an issue. And supplemental zinc here actually decreases the insulin resistance and the high blood sugar. And many also take these ACE inhibitors and diuretics in this group. They deplete zinc. So they're already low in zinc, and then they get more problems with zinc. So why is this such a terrible problem? Well, they have shown that zinc blocks the initiation step of COVID-19 replication. And you can just see it with this chloroquine, which brings zinc into the cells and is a treatment for COVID-19. But why is it? This is something really, I think, pretty exciting because it actually causes ketosis or fat burning. It raises this major hormone, fat-burning hormone, adiponectin. And it is found to improve insulin resistance, and it lowered blood sugar. So here we go, insulin resistance, blood sugar, fatty liver. Once again, these are the key things to think about when you think about COVID-19. Chloroquine also lowers the interleukin-6, which is a terrible problem with COVID-19 and a big part of the cytokine storm. And then we have zinc superoxide dismutase needs zinc to function, and that is a major antioxidant that is really needed with COVID-19. And then there's COVID-19 comes into this receptor called ACE2, and that's a zinc enzyme. So it's now we have dysfunctional ACE2, but ACE2 is extremely important. So we want to be able to build that up again. ACE2 normally breaks down bradykinin. It causes, and this is a direct cause of the cough, the dry cough that you get, and actually the fever, the loss of taste and smell. That's another part of it. And this activity of ACE2 is highly sensitive, as a study showed, to zinc deficiency. So these things are all related very closely together. And so zinc lozenges have been recommended to help protect against COVID-19. It is sort of controversial, but this certainly has happened. Like I said, the quercetin treats COVID-19, and this is one thing that quercetin has been found to do, is increasing zinc absorption. And like I said, zinc activates vitamin D as well. So it's depleted with so many things: refined carbs, caffeine, smoking, alcohol, also birth control pills, intense and other medications, intense exercise. Now zinc competes with copper for absorption, and we need it to control copper levels. And those that acrolein is made in the end from some copper enzymes, so that might have something to do with it. So how do we even get it? Well, it's fine in there's plenty in meat, especially in beef and oysters. But from plant sources, it is blocked up to 50% due to the phytates and other plant sort of anti-nutrients. So, um, just as a summary, I'm trying to really focus here because there's been so much information about COVID-19. It's incredible, and we're just going all over the place. But these are things that we know. These are very well established, and they're things you can do something about. So just focusing on this, you can make a great deal of progress. Basically, the problem of seed oils and all that are replacing our arachidonic acid, we've got to change that. The carbs, the alcohol, smoking, caffeine, now those just deplete our zinc and our B1, so we've got to change that. Endocrine disruptors, these xenoestrogens, they bind to lysine. We have to avoid them. Like I said, they are right in our house. So we need to just take a good look around our house and just see where what to do about that. So how did we get here? Well, it's you may have already seen this kind of thing, but I think it's pretty interesting that, starting way back in 1956, the American Heart Association said that egg yolks and animal fat, which are high in arachidonic acid, are unhealthy. So we were then told to eat these seed oils. And eggs are high in choline too, and just as about fatty liver, humans eating low choline diets develop fatty liver. That's what that study says. So, and then it got worse in 1970, because of course it didn't help. In fact, it got worse altogether because of this. So by 1979, we were wrenched in a little closer to this, and we had to go on the high carb, low fat diet. But of course, it was low in energy, so people ate more grains that were very low in lysine, more refined grains, more sugar, and more sweet caffeinated drinks. But of course, they all deplete zinc and B1, and we have no energy, so a vicious cycle of more and more carbs and caffeine and grains and all this stuff, and smoking. So just so we can focus. This all ends up in the low energy, the brain fog, which is also part of the high copper, a big part of high copper. These things are absolutely critical. And then as time went on, we've got basically 1980, actually it's the exact time, the same time, non-alcoholic fatty liver was first diagnosed. At this point, red meat is already going down. Eggs are going down. They just don't have, this is something that had been going on earlier, of course, and they finally did it. But, beef, again, is high in zinc, low in linoleic. It's really the lowest in linoleic acid of any of the meats that I've looked at. So it's really important. And the eggs are very high in arachidonic acid. So, but of course, we're just not eating those anymore. So then we've got the diabetes. Now, diabetes hardly existed. It was pretty big, in the 30s, but percentage-wise of the whole population, it was less than 1% for the longest time, and until 1960, when, like I said, we were told to start eating these modern oils, and now at this point in 1960, for the first time, they're eating more than butter and lard. Moving forward in time, they just skyrocketed after 1990, when, like I said, they switched over to frying foods in modern oils rather than in beef tallow. And this is the first time that juvenile type 2 diabetes was diagnosed. Now, there is the part to be played with chemicals, and I don't want to discount that at all. It certainly is there. And we've got there's BPA, there's some birth control, there's lead, arsenic, pesticides, BHA, personal care products, and like I said, they bind to lysine, and they are linked. These endocrine disruptors are linked absolutely to insulin resistance, obesity, and asthma. So Now, diabetics are still being told to eat the seed oils, legume and seed oils, and to avoid eggs, liver, red meat. Yet the original diet formulated to treat diabetes, which my grandmother was actually on in 1935 for a while until insulin was invented and she stopped, was animal fat, eggs, meat and veggies, the keto diet. And this diet is high in arachidonic acid, lysine, and zinc. So, trying to get some sense to all this, let's look at a low linoleic acid. So for 12-week diet low in linoleic acid, those free radicals, those HODs, were significantly reduced. And the researchers were really going for this whole thing that trying to cure fatty liver. And this is the way to do it here. And the ketogenic diet takes up right from there. The original treatment for diabetes, it improves high blood sugar, fatty liver, high in these very important nutrients. And one of the major benefits of ketosis is detoxification of chemicals. So this is really an important idea for COVID-19 in helping that the terrain that makes people so vulnerable. And the simple thing of here that the liver fat went down, one would believe. Now beef fat is very interesting. Beef fat plus MCT oil improved the alcoholic fatty liver disease when it was promoted. See, alcoholic fatty liver disease is caused by alcohol, but really not everybody gets it. It is, and I've heard this is something that has to be there, but I don't know, that linoleic acid is a big part of this too. And this particular study showed that it was promoted by corn oil and then the beef fat plus the MCT oil, which are both ketogenic saturated fats, improved that. Beef fat is the lowest in linoleic acid and the highest in stearic acid, which is a very healthy saturated fat by any standard. And here's a good example of a ketogenic meal: beef, carrot, and turnip stew rather than potatoes. Who wouldn't want, this very healthy and wonderful dish? And then a low-carb diet reduced the blood sugar after the meal, and that's pretty obvious that would happen. So just to wrap this up here, we can lower high blood sugar and the fat-building insulin. We can stop sugar cravings, which are pretty hard to stop, and replace essential fats, lysine, zinc, and B1 with an ancestral foods ketogenic diet. So, and this does really all of the things that we're needing to do right now to avoid the COVID-19 problems. And I'm on one right myself, and this is what inspired me, partly what inspired me to get this together, because there is a way out of it, and it's not hard, and it's a very delightful or delicious diet. And I have one that I've just sort of zeroed in on: the most ketogenic foods and condiments that all induce fat burning, because that is the important thing. Or also there's a low carb maintenance version of this diet with wonderful meals, and also includes the classic European sourdough whole grain rye bread. And I actually follow that diet, and it is just wonderful. Just as a picture of the whole thing, just going through, you've got spaghetti squash casserole, you've got kind of the classic sort of keto dishes that are very satisfying and not hard to make. Cauliflower crusted pizza, bunless burger, got pumpkin custard, salmon loaf, shrimp, a shrimp dish, Italian egg drop soup, omelets with I think that was beet greens, and some chorizo liver with mushrooms, cabbage rolls with spicy beef, chicken soup, jalapeno poppers, rutabaga, Hasselback rutabaga, the Swedish dish, and there's a Greek gyros salad, a hot sort of chutney, because that really induces ketosis, a low carb Thanksgiving meal, kind of smaller servings of a ham and bean soup or split pea soup, Finnish fish dish, we have the Danish smørrebrød, which is the rye bread with open face sandwiches. You can have a little bit of that certainly on the maintenance dish. This is covering up the carrots that are braised in chicken soup or chicken broth. A Polish kind of sauerkraut and sausage soup, another smørrebrød, which is with salmon and dill. Dill is another great ketosis inducer. Pulled pork minus the sugar with avocado, a fatty fish like cod with a mango salsa, and the sauces made with chicken broth, and eggplant with feta cheese. And this is just the beginning, just a taste of this wonderful diet. So, well, thank you so much for watching, and please contact me with any questions or comments to obtain a list of references, learn about the Ancestral Foods Ketogenic Diet, or to schedule a presentation. Please go to this website down here, and I thank you very much.